Africa. As concerns rise about the 2 Americans bringing Ebola to the U.S., medical professionals say they have been trained to treat the Ebola virus with caution and safety.
It's really scary to think that this is coming toward the U.S., in fact, here now. News specialist Ann Forrester joins us live this morning from Intermountain Medical Center to show us how Utah would handle someone with an infectious disease. Hi, Ann.
Hi, guys. So Intermountain Medical Center is one of 2 places in the state equipped to handle any disease. Now, from these first moments, it's critical when a patient enters the ER how they're going to be treated by medical personnel, whether it's the Ebola virus or simply the flu. Joining me now is John Little. He's the assistant manager with the Emergency Department. Now, John, tell us, when a patient first comes in, how are they treated?
When a patient first comes in, we ask what their symptoms are. If they tell me they have the cough, flu, rash, fever, whatever, we have masks for everybody. That's our first line of defense. Basically, I should say our first line of defense is to have everybody wash their hands. You wash it as frequently as you can. You mask the patient, and then we treat them as if they're infected at some point, and then until they're proven innocent. We have all individual rooms in the back, so when they go back with a mask on, they're back into an individual room, and that's the way it goes. If we have a full lobby, we can try and set some more infectious patients over in an area that's not. If even a family member comes in and they're coughing with somebody else, we ask them to wear a mask. It's kind of like if you've ever been to Japan and you see everybody walking around with masks, they're more preventive. I've had my staff, if they feel that they have a respiratory infection, they'll wear a mask as they go into a patient's room. So masks are a line of defense. Hand washing is the first line of defense.
And if a patient comes in with Ebola, there's no telling if that's what it is right when they enter the ER.
The way we know if there's Ebola, first of all, the CDC and our health department would keep us informed of any cases of Ebola that possibly would be in the area. So we would be alerted, and that would be a whole different step up of how our precautions are. During the N1H1 flu season, when we knew there were a lot of people having flu, we established a perimeter area where we just kept all our flu patients, walked them into a certain waiting area. When they were ready to be seen, they went from that right into another area that was strictly closed off for just the flu patients, and they actually even left the department from a different area. So they never came in contact with the main part of the emergency department.
John Little, thank you. So first of all, precaution is the #1 step that medical personnel take, whether it's hand washing, using hand sanitizer, and using a mask to protect medical personnel and other patients here as well. Now, come back in half an hour. We will show you a one-of-a-kind room used to protect medical staff in any case of an infectious disease outbreak. Back to you guys.
All right, Ann Forrester, thank you for that update. We'll check back in with you in just a bit.